So good day everyone. I'm here for this video talking about on how to assess the abdominal of our patient. So first things first is we need to determine the abdominal quadrant and also the abdominal region. So abdominal quadrant is the first. So we are going to size it into by 4 kay upat man ka quadrant ang naatato. So here is the right upper quadrant, left upper quadrant, and then here's the right lower quadrant, and then also here is the left lower quadrant. So that is the abdominal quadrant. And then next is the abdominal region. So there are 9. So maana na siya. Alright. So let's assume nga nakita ninyo ang kuan. So, I'm gonna put some pictures na lang after this. So, here is the right hypochondriac region. And then, tunga nga ria is the epigastric region. And then, here is the left hypochondriac region. So, ang area ng sad is sa tunga, ngari, is the right lumbar region. And then, ang pinakatunga is the umbilical region. And then here is the left lumbar region. Here is the right iliac inguinal region. Here is the hypogastric region. And then here is the left iliac inguinal region. So that's it for the abdominal region. So now again, I will gonna put some pictures para makaibaw mo og asa. Right, so for the first to assess is to inspect the abdominal contour. So let's just sit. So I'm here sitting na, and then also the camera is nakainani na siya to look across the abdomen at a level slightly higher than the client's abdomen. So nakainani na siya. This is where to measure the girth if kuan basad siya. So, kung level ba ang iyakan. So, as we can see nga, ang iyang kuan is that flat siya. Yes, so flat ang iyakan. So, it means nga, ang ato pasyente has a normal finding. So it's just a mannequin, guys. So, let's just assume nga tao ni siya, and then mo ni ang iyang kuan. So, abdominal, ang iyang abdomen. So, flat ang iyang kuan. So, alright, so it means our patient has a normal finding. Next is we are going to inspect the symmetry of our patient, the abdomen of our patient, and then we are going to note if there are any protrusions, and then bulging, or any lumps with the client's supine, with the client's head raise. So, it means that we are going to look at the abdomen as the client lies, and then nakarelax siyang position. So as we can see, symmetric naman sa dangiyahang pagkuan. There are no bulges or lumps. No bulges that are noted when the client raises the head. So wala man say mga something stretch marks nga naa sa iyahang abdomen. Alright, so next is we are going to inspect the stray of our patient. So as you can see, wala siya linings nga diri. So it means that our patient has there are no noted of stray. So it means our patient has a normal finding. Next is we are going to inspect the umbilicus, or bali kanang to note the color, and then also the location and the contour of our patient. So as you can see, to note this, we can see nga kanang ang skin tones niya are symmetric of the surrounding of the abdominal skin tones, or even pinkish. Pwede mo siya pinkish, but still kanang same na siya og color. And then to observe the umbilical location, so umbilical, di ba ang umbilical nasa tunga, so naadi siya midline or the lateral line. Next is to assess the contour of the umbilicus. So as you can see nga, it is recessed or some inverted or protruding, that there are no more 0.5 cm, and it's around or ni conical man sad. Gali naman jud siya sa tunga. So moto siya. And then so it means that again, To document the finding, it is midline, recessed, and without bulging. So, our patient has a normal finding. So, next is we are going to inspect the aortic pulsation of our patient. If slight ba siya, so beato kanon. It is slight pulsation of the abdominal aorta, so it is visible in the epigastrium and then extended in a full length in thin people. And then so it means to document the finding, slight pulsation na siya. So bali makita ninyo nga mukuan ang tiyan jud. So it means the patient kung inana, it means it has a normal finding. Alright, so next is we are going to inspect the peristaltic waves of our patient. So as you can see, human naman ta ganina for determining the aortic pulsation. So now the peristaltic waves na. So as you can see, wala man, there are no noted, there are no cannot be seen. So although they may be visible in very thin people as light ripples on the abdominal wall. So ang ato patient medyo niwang man siya, pero at least gihapoy makita nga na ay mag-wave sa. So it means our patient has a normal finding in the peristaltic waves. Alright, next is we are going to auscultate the bowel sounds of our patient. So it means that we are going to use the diaphragm of the stethoscope and to make sure that it is warm before we going to place the client's abdomen. So we are going to start or begin in the right left quadrant here. So now, and then clockwise, yeah. So now I'm going to Alright, so we are now going to document now the finding. So as we hear that there are some soft gargles and then some click heard at a rate of 15 per minute. So it means that it also a series of some soft clicks like I said, and then some sounds that refers as a borborygmus, or mga term nga ato makita, some gurgles nga sound nga atong mabatian basta nadir sa ato ang abdomen. So it means that our patient has a normal finding. Alright, so next we are going to auscultate. So still we are going to use some stethoscope, and then this is where to auscultate the vascular sounds and then the friction rub. So we are going to note if there are to listen the bruise, and then also the venous hums, the friction, the rubs over the liver, and then also the spleen. So now we are going now to proceed. So first is we are going to determine the aorta of our patient. So if there are murmur like sounds, and then Raina. So the aorta is here. Okay. Alright. So next is we are going to determine the renal. So the renal is here. Alright. Okay. Next is the iliac artery, which is here. So next is the femoral arteries, which is somewhat like here. Alright. So now, let us now gonna document the finding of our patient that the bruits are not normally heard over when sat in the abdominal abdominal aorta or the renal iliac. So it means or the femoral artery. So however, the bruits was confined to systole or maybe normal in some clients depending on the differentiating factors. So it means that there are no bruits or some venous harms or frictions that are rubs was noted. So our patient has a normal finding. So next is we are going to percuss now the patient. So we are going to percuss some tone of our patient. So we are going to follow some sequence starting right here on the right upper quadrant. So here. Then sampa naman na siya. Sampa na. Tingnan ko ma'am na yung sakit ma'am ha. Then down here. Then the petere. Then here. Alright, so as I percuss, so there are it was generous the tympani over all the four quadrants. So it means that over the abdomen, the tympani predominates over, so because of the air in the stomach and the intestine. So dullness is heard over also over the liver and the spleen. So it means that our patient has a normal finding. Alright, next is we are going to palpate the masses of our patient. So we are going to palpate tracet. Since we are going to note the location and then the size in centimeter, the shape, the consistency, demacration, pulsatility, tenderness, and the mobility. So as we palpate, there are no masses, no pain, no tenderness that is palpable on the abdomen. So our patient has a normal finding. So alright, for this video, we are going now to proceed to percuss and palpate the kidney. So we are going to note the tenderness on the blunt, the percussion if enlarged, on a palpation, to note the consistency and presence of needle. So I have here another patient ng kahapon. So we are going to blunt now the percussion of the kidney. So the kidney is here. Alright, so sir, why is it, sir? Alright. And then also, we are going now to palpate the kidney nga dapat nakahigda ang patient. Alright, so nakahigda na ito patient. So now we are going now to palpate the kidney of our patient. So ang kidney nato is naa diri. So ato ni siya ikuan. Okay, ana. Okay. Yan sa pikas pod. So now we are going to document the finding of our patient. So there are non-tender on the blunt percussion of a CVA. So they are not palpable naman sad also. So it means our patient has a normal finding. Alright, so next we are going to percuss and palpate the urinary bladder of our patient. So we are going to note the tenderness and the consistency. So for this video, to palpate the distended bladder, dapat na diri akay ang ato urinary bladder na aman diri ang dapit. So we are now to palpate it. So you can see, as we palpate and then the percuss, so it means nga, to document the finding, our patient has a flat percussion tone on an empty bladder and then there are not palpable. So it means our patient has a normal finding. Alright, so next is we are going to assess by inspecting the abdominal girth of our patient. So, I have here tape measure. Ako nagibot ang dadaan. Be exact, so nakainana na siya. So, the patient centimeter finding has 72 centimeter. So, but still it is normal finding. Okay. Ang ato ang normal finding is 80 centimeter, but medyo gamay lang og nga adapit ang sa ato ang abdomen sa ato patient. That is why 72 ra siya. So, alright. So, thank you, sir, for cooperating. Alright, so next is we are going to percuss the shifting dullness of our patient. This is where to note the areas of tympani and then the dullness with each position change. So it means ang ato pasyente is to assess the shifting dullness, dapat ato pasyente is kumubutod ba siya inana. So sir, pwede sir tagilid gamay, sir. No, diri dapat ato bang sir sa camera. Tagilid gamay. So, mara siya ang stomach sa ato ang pasyente. Okay raman sad siya. So, constant raman sad siya. And then also, balik sir sa kuan. Balik sir nga nakahigda og tarong. Right. So you can see, wala magyapoy butod siya. So, it means the shifting dullness of our patient is constant border between the tympani and the dullness. Tympani is here, then dullness. Then throughout the position changes. Alright, so next is we are going to percuss the shifting dullness of our patient. This is where to note the areas of tympani and then the dullness with each position change. So it means ang ato pasyente is to assess the shifting dullness, dapat ato pasyente is kumubutod ba siya inana. So sir, pwede sir tagilid gamay, sir. No, diri dapat ato bang sir sa camera. Tagilid gamay. So, mara siya ang stomach sa ato ang pasyente. Okay raman sad siya. So, constant raman sad siya. And then also, balik sir sa kuan. Balik sir nga nakahigda og tarong. Right. So you can see, wala magyapoy butod siya. So, it means the shifting dullness of our patient is constant border between the tympani and the dullness. Tympani is here, then dullness. Then throughout the position changes. Alright, next is we are going to percuss some fluid wave tests. And then this is where to note the transmission of the fluid waves. So, diba, if we are going to, nakaana dapat ni siya para sa atong patient. So, this is where to determine na kung flow ba siya ang waves sa sud. Okay, sir? Ako kuanan, sir, ha? Alright? Alright. So, now we are going to document the finding that as we percuss the fluid wave test, there are no fluid wave was transmitted. So, our patient has a normal finding. Next is we are going to palpate the rebound tenderness of our patient. So, syempre, for this assessing is that the client has an abdominal pain or tenderness, and then we are going to test the rebound tenderness, as what I've said, by palpating deeply a 90-degree into the abdomen away from the painful or the tender area. So, we are going to release some pressure sad also. Okay, sir, ako kanon, sir, ha? Okay. Tay sakit, sir? Medyo, sa pag-ano rin ako, sir, no? Alright, so, after that, now we are going now to document the finding na medyo nasakitan ng ato pasyente, pero sa pagpalpate na ako, inana. So, but there are no rebound tenderness was present as I palpate to the patient. So, thank you, sir. God bless. Alright, so now we are going to palpate the psoas sign. So this is where to note the presence of the abdominal pain. So as you can see nga, nadili na ang abdominal ato gi-focus. It is nga ang kaninang tiil. So it means nga nang connected ba siya if ever I'll gonna palpate the ang palpate ang tiil sa ato ang patient. So kung mo kuan ba, sir, ako ay cancer ha. Kung mo connect bag sakit po ang imong tiyan. Sakit ba, sir? Alright. So, as we document the finding, our patient has said that there are no pain was present. So, wala may sakit ko, no? So, it means our patient has a normal finding. Alright, so next is that we are going now to palpate also some other signs which is called the obturator signs. So for the obturator signs, we are going to note also the presence of the abdominal pain. So kaganina ato ra gisaka ang tiil. So for this video, we are going to kuan the pain ang tiil. So sir, ako yana sir ha. So medyo sakit sir, dili. Okay, now we are going to document the finding that still our patient has no pain was present of the obturator sign. So our patient has a normal finding. Alright, so for the last is that we are going to palpate the Murphy's sign of our patient. Still, we are going to note the presence of the abdominal pain. So, still, dire alang siya. And then, sir, if ever sakit man gani siya, sulti lang daan. So, I can stop, okay? So, okay. Let's balik ka, sir, ha? Alright, so, now, as we document the finding, kanang, our patient has said that it's very painful. So, sir, kanang, sakit man siya. So, can you please rate the level of our son kanang sa pinakasakit from 0 is the no pain at all, and then 10 has the worst pain at all. So 0 to 10 sir, pili lang kaon sa kasakit.
7.
So nasa 7. Alright, so again, so for the document the finding, there is a pain into a 7 level, and then that is present upon the inspiration. So that's it for assessing the abdomen, and thank you and God bless.